Welcome back. It is 9/11. Children make up more than almost 30% of the weekly U.S. COVID-19 cases that we are now seeing. The update comes as schools across the U.S. have been opening up or are now in full swing. The rising number of cases is worrisome, not only for parents and teachers, but also school nurses, especially with the school nursing shortage being a big problem. That's where telemedicine is now playing a role. And we are joined by Josh Golomb of the in-school telemedicine provider called Hazel Health. Good morning to you, Josh. Good to see you.
Good morning, Sylvia.
This is such an interesting topic because we hear so much about how telemedicine has been reborn because of this pandemic, but you don't often think about how it can help schools. So explain how this works.
Yeah, well, first let me say school nurses just play such an incredible role across the country. They're really the front line of healthcare for our kids. And for some kids, they end up actually playing almost their primary care provider role. And nationally, so the American Academy of Pediatrics suggests that we have a school nurse in every school, or roughly for every 750 kids. But we've been struggling. And so only nationally about one nurse to every 1,500 kids. And in Illinois, it's actually double that. So it's one nurse to every 2,900 or so kids, which means that most schools now don't have a school nurse, a dedicated one. And they're often in Illinois working across 4 or 5 or even more schools. And so the idea with telehealth is making on-demand access so that while a child is at school, even if their nurse is at another site, they can see one of our doctors or other specialists right there on site.
Okay, did you say one nurse per 2,900 kids in Illinois? Is that what you just said?
That's what I said.
Wow.
And so when you think about our nurses, just the amount of, and that was pre-COVID. And so now when you think about the complexity of the Delta variant and everything happening, they're doing just heroic work every day, but they're very stretched.
You know, when I was a kid, we all had school nurses, and a lot of the suburban school districts do. Obviously, city schools, that's not the same situation. So I'm curious, are we seeing more schools taking advantage of this telehealth situation? And how many does your company actually serve?
Yeah, so we actually, it meant we've grown a lot. So now across the country, we work with districts that represent almost 2 million kids. And it's been a great partnership for us with school districts and with school nurses in the community, because there's a realization that more and more families need care. Schools are such a great place to connect to kids and their families. And so it's really led to us a lot of growth very quickly, and fantastic feedback from both the nurses that we work with, but also from families. But one of the things, I'm a parent of 3 kids myself, and the amount of time that you sometimes have to take away from work because you can't get into a doctor. And our families tell us that they save about 3 hours of missed work time when they're able to get a child seen at school by either the nurse or by our telehealth program.
You know, I think we learned during COVID, I think telemedicine kind of had a stigma to it before COVID because people thought, oh, you want to have that one-on-one. But then we were forced to do the telemedicine and discovered how effective it can actually be. So give me an example of how this would work with a child at an individual school system.
Yeah, I mean, in some ways, I think the easiest, like I just think of my own kids, and just something as simple as pink eye. And so a child who may have something that show up in class, if they don't feel well, they now come into the school office, and whether or not there's a nurse there, or if the nurse happens to be in another school, that they can, within literally 3 minutes, with parent consent, see one of our providers. So we have an iPad, we can take all their vitals on site, and then they see one of our providers that works full time. And this is what they do all day and out. They see kids remotely. And so it gives us a chance. Our goal number one is if a child's healthy enough to stay in school and avoid missed learning time, we find about 90% of the time we can actually treat that child and get them back to class. Or if they needed to go home, we could have already called in a prescription for the parent if it was appropriate. So on the way home, the parent can know that they can already stop by the pharmacy and avoid having to go to the late night urgent care or emergency room visit. And at the same time, our job is to coordinate with our local family doctor to make sure there's good continuity.
So is this a cost-saving alternative for a lot of these schools who can't have the nurses?
Yeah, I mean, in a perfect world for us, every school would have a school nurse. And so what we're really actually trying to do is to bring in more resources from outside to help supplement that. And so, but our perfect world from our perspective, every school in Illinois would have a dedicated school nurse that we would be alongside. Because when we work together, sometimes we're actually able to tackle things more like asthma, diabetes, a lot of the things that are keeping kids out of school for much longer. When we work together, we've been seeing the ability to make big differences in those chronic diseases.
So what do you want parents to know who have children who go to schools that use Hazel Health and other telemedicine services about telemedicine and their child's health? What do you want to say to them or reassure them about?
Yeah, I would say that for telehealth, for both the industry has grown a lot, but a lot of when we work with schools, that number one, things always need to be in partnership with your local district and your local community. But there is now a lot of rigor behind this. It's doctors that before were working in clinical practice that are now bringing what they do to their families and to schools, and that there's great communication and engagement. But it is, my own kids use Hazel and telehealth, and it can be a great supporting alternative, and it doesn't in any way interfere with the importance of having a great local doctor in your community.
Josh Golomb with Hazel Health, I thank you for joining us, and I also want to thank you for giving credit where credit is due to school nurses, because obviously it sounds like working together makes it even better for everybody. So thank you for your time.
Thanks, Sylvia.
We'll be right back.